back. Hi everyone, I'm Dr. Terri Alani, the Texas Tooth Lady. Thank you for subscribing to my YouTube channel. You just click on the button on the lower right and that will keep you updated on all the latest videos we have. Today we're going to talk about something different, sleep apnea. A lot of people wonder, well, when they come to the dentist, that we're just about the teeth, but we're not. We can actually diagnose health issues and make you more aware. Sleep apnea is something that can actually kill people. What happens is you're depriving your body from oxygen when you sleep. So we have a patient here and we're going to talk about it. All right, we have Linda with us today. She's been a patient of mine, and we were talking and I noticed her tongue was rather large, which basically it's blocking the airway. And I asked her if she had had sleep apnea. And so how did you decide that there was something wrong?
I just was always tired, and I just kept telling my doctor how fatigued I felt all the time. And I got to the point that the fatigue was so bad until some days I just feel like I was going to collapse if I didn't sit down or lay down. And then, you know, at first they thought it was just part of the hypertension, but I just kept going back saying, I'm just so tired. I don't care if I sleep 12 hours a day. I wake up, it's like I didn't sleep at all. And finally, that's when he said, well, asked me had I ever had a sleep study, and I told him no. So when I had the sleep study, that's when I discovered that I had sleep apnea.
And the thing is with sleep apnea is, for patients that aren't aware, first of all, you wake up at night a lot, right? And a lot of people snore, some people might not. But the other thing is you're tired during the day, and you could be irritable. I know I diagnosed it in my dad. I was working one day and my dad was out in the reception area and he was asleep. And it was the middle of the day and I thought, why is he sleepy? And so these are symptoms, and what it does, if it's not diagnosed, it can put a lot of stress on your heart and you can have a stroke. So many people that have high blood pressure also have sleep apnea. And I want to take a look because I notice your tongue is large, and a lot of times that is an indicator because it can block your airway. So let's take a look. All right, go ahead and open, please, as big as you can, and stick your tongue out. Now, looking at her, you can tell that her tongue occupies a lot of her mouth. Say ah. And I can't even see the back of her throat. So that right there was an indicator. Okay, back again. That right there was an indicator that she's probably having a difficult time breathing at night, because when she's sleeping, her tongue is pushed back and blocks the airway. And that's what we call sleep apnea. So what treatment did they recommend for you to help you with your sleep apnea?
After I had the sleep study and it was determined I did have it, I had to wear a machine at night when I go to sleep.
The CPAP machine. Yes.
CPAP
yes.
Machine. And it would help me to help me to breathe better at night. And they told me I actually stopped breathing while I was sleeping.
Yes.
And the fact that they said that I was so tired during the day was because I'm fighting all night long trying to breathe. So the CPAP machine helped a lot.
Yeah, and the CPAP machine is something that you actually wear over your mouth and your nose, and what it does, the oxygen forces the airway, forces air down your throat, so you're actually, down your airway, so you're actually able to breathe uniformly at night. So do you feel a lot better?
Yeah.
Like a whole different person, huh?
Yeah.
And it probably will extend years on your life as well. So if you have a loved one that snores, may be overweight, is getting tired in the day, is irritable, it could be sleep apnea, and we as dentists are one of the first lines of defense in diagnosing it. So make sure you think about that. I'm Dr. Terri Alani, the Texas Tooth Lady. Thank you for subscribing.